In the United States, there's a different kind of problem when it comes to prescription drugs: cost. Across the board, prices for the same medications are generally much higher in the United States than elsewhere. Cheaper drugs, known as generics, are supposed to be a better option for consumers. But as Jim Spellman found out, there may be some serious problems with the system.
Martin Shkreli has become the poster boy for greed in the pharmaceutical industry.
On the advice of counsel, I invoke my Fifth Amendment privilege against self-incrimination and respectfully decline to answer your question.
His former company, Soaring Pharmaceuticals, acquired the rights to a medication used to treat a rare condition, then jacked up the price.
Soaring Pharmaceuticals purchased the prescription drug Daraprim and raised the price per pill from $13.50 to more than $750.
It could be years before a cheaper generic alternative is on the market.
The FDA, the Federal Drug Administration, is responsible for approving applications to manufacture generic drugs, but it's drowning in a backlog of applications.
In the U.S., a pharmaceutical patent lasts 20 years or longer. When the patent expires, other companies may apply to manufacture the drug, which usually drives down prices. Nearly 80% of prescription drugs in the U.S. are for generics. They generally cost 80 to 85% less than brand names and save U.S. consumers more than $150 billion a year. The first company applying to make a generic drug may sell the medication for 6 months without generic competition. But the FDA has a backlog of 3,700 applications. Companies sometimes wait several years for the FDA to get a 10 to 15. Critics say even that's too long.
If there's only one manufacturer in the generic market, they've basically got the 15 months it takes, and I'm going to argue that number with you. They've got an exclusive ability to sell that drug for 15 months at $1 million a pill if they choose to do that.
Right.
The generic drugs must be tested to prove they are as effective as the brand name versions. The FDA says these rigorous technical and safety rules have led to the backlog. A 2012 law that promised to speed up the process while charging pharmaceutical companies an extra $1.5 billion over 5 years has not decreased the backlog.
If you raise prices and you don't take that cash and put it back into research, I think it's despicable.
Meantime, companies like Turing can make huge profits while consumers are paying sky-high drug prices. Americans without health insurance are often hit hardest when there is no generic option on the market.
Every day you delay getting a competitor on the market is a day companies can screw the consumer.
Daraprim is available for just pennies to a few dollars a pill in other countries. It's unclear when or if a generic version of the drug will become available in the United States. Jim Spellman, CCTV, Washington.